Am I too old for testosterone replacement therapy? Well, that's not the right question. The question is, do I need testosterone replacement therapy? And the actual question is, do I have a deficiency? Should age be a consideration when deciding if a patient is a suitable candidate for testosterone replacement therapy? Now, the answer to that question is no, not really. We know there are physical and psychological benefits from having an optimized testosterone level. We're not talking about supraphysiological levels. We're talking about levels that fall within the normal physiological parameters, aka your genetic code wants you to have a certain male androgen level. Now, why does it want you to have a certain male androgen level? Well, if you just look at it from a perfectly biological perspective, you're supposed to grow up, go through puberty, and I suppose in your 20s, you're supposed to go out and find a mate. Find that mate, procreate, and then stay healthy long enough for that child to grow up into adulthood and do the same. So essentially, it's the circle of life. I do love quoting Lion King. Now, you're supposed to disappear. So the concept of great-great-grandparents is quite absurd from a biological perspective. You know, Mother Nature. It doesn't really make sense. Resources, etc., etc. Now, men are superior to females. Sorry, Lydia. We are. Because women at sort of around 50 go through the menopause. So they no longer have eggs. So they can no longer procreate. Men, we should retain the capacity to procreate. Now, why is that? Well, women have to bear the child and have to raise the child, so they do need to be physically and psychologically healthy in order to do that. So there's no point having a child and then not being able to raise it properly. Now, men, we do retain the capacity to procreate when we're in our 40s, 50s, 60s, 70s, 80s. Just look at old thingamajiggy from the Rolling Stones. Mick Jagger, you dirty old dog. Wow. You know, so why would you retain the capability? It's essentially all about survival of the species. So if there was a biological need for somebody in their 60s and 70s to be able to procreate, then it could happen. So we are fulfilling our biological function or our biological imperative. So testosterone levels decline with age. Now, they decline with age for a reason. We're not supposed to be here forever. Now, that's the truth. Now, what do we do in our modern society? Well, we defy nature constantly. So if you look at it from a puritanical perspective, you shouldn't take blood pressure medications. You shouldn't take anti-diabetic drugs because that's going against nature. Nature's intention is for you to procreate, stay healthy long enough for that child to grow up, and then you're supposed to make way for the next future generation. So one of the ways that happens is your testosterone levels decline, you become more susceptible to chronic disease, your telomeres unwind, so you're supposed to fade away. Now, I don't want to fade away. It's better to burn out than fade away. But the reality is you're not burning out. If you maintain your male androgen levels to within normal physiological parameters, and you look at all the other aspects of health and address them, then you're not really burning out. You're living life to the max. You are appreciating the importance of quality, not just quantity. And that's really what it's all about. You know, we want to have a high quality of life. I've done urgent care for many years, and I've visited my fair share of nursing homes, and I've walked in and I've watched these poor old fellas sat there waiting for lunch, watching Jeremy Carl. They physically cannot do anything. That's not a life I want to lead. I want to be physically and mentally active for my whole life. I don't want to fade away. So I don't know who would want to fade away. I mean, there's an absurdity to that. So testosterone replacement therapy. Are you ever too old for testosterone replacement therapy? Well, the answer to that is no. But again, you have to have a deficiency. This is a pathological condition. So if you have the symptoms of low testosterone, and you know, I'm pretty sure the majority of 60, 70-year-olds obviously do have symptoms of low testosterone, and you would be able to confirm that with diagnostic blood tests. So I don't think it's actually any different. You know, if you have a deficiency and it's confirmed, why would you not want to correct that deficiency and live a life of fullness, of quality? Live life. That's what it's about. You know, my God, the concept of sitting there waiting for my lunch, watching frickin' Jeremy Kyle, and then I don't know, whatever daytime TV is, probably Doctors. a truly atrocious program. Yeah, live life. That's what it's all about. So the answer is, there is no answer to are you too old, what's the right age for testosterone replacement therapy. Age shouldn't really come into the equation. It should be, do you have a deficiency? Can I correct it? Do the benefits outweigh the risks? You know, and it's only through counselling and having a true appreciation of the subject can you make that decision, and you should make that decision with your clinician. So, yeah, there you go. Am I too old? That's not the right question. Do I have a deficiency? That's the right question.